Egg retrieval is a very important part of the IVF process. Basically, many things depend on that day of egg retrieval, because the quality and the quantity of oocytes that are going to be retrieved, that will decide your fertilization rate and subsequently how many embryos are made and your pregnancy rate. So, to be very frank, before the egg collection, first and foremost, you have to keep your mind very cool, because what happens, the anxiety levels are very high in these patients when they are going for the egg retrieval. They feel that what is going to happen now. They are very much scared of the anesthesia. So anesthesia is not anything that needs to be much scared about, because in this process a general anesthesia is not given. You are given an IV sedation, so it is not going to have major impact on your body. You should always take your trigger injection on time. This is the foremost thing, because the trigger injection decides that how many eggs are going to be retrieved, the quality, the maturity of the egg. So please follow the doctor's prescription and take the trigger injection on time. Follow all the pre-op instructions that is mentioned, that the doctor has given you, like don't come full stomach, always take your thyroid medications, diabetic medications, antihypertensive medications on the day of pickup. Not eating anything does not mean that you have to skip these medications. Other medications you can skip, but the medical disorder medications you need to take. Please always reach the IVF center on time. That is very essential, and with your male partner, because the sperms are needed that date, unless and until the sperms are already frozen beforehand. So, but if the husband is not coming, you have to have somebody who is going to accompany you and who is that much sensible. So these are some of the tips that you have to follow before the egg retrieval. Secondly, whenever you enter the OT, the operation theatre for egg retrieval, always go empty bladder. You should pass urine before entering the operation theatre. That will be assisted by the staff there also at the IVF center. Secondly, always verify your name, because what happens, everybody asks your name and the name is asked with the husband's name, because that you are given a tag for this. But what happens in the patient anxiety, they never confirm this name. This I have seen in practical practice during the IVF OT. So don't do that, don't be scared. In fact, you should feel happy that you have taken so many injections, so many ordeal, and now this thing is going to end. Now you're going towards the final process. During the OT, you have to be very calm when the anesthetist asks you all the question regarding your allergies, because usually the pre-anesthetic checkup also happens, but what happens, many times your mind skips. So on the OT table also, the anesthetist always asks whether you have eaten anything, whether you have taken any water, what all allergies you have. So you have to be very true that time. You have to speak the truth, whether you took the trigger injection or time or not, because that is also the time you can stop the process. Because if you have not taken it on time, please do tell the doctor. So during the process also, procedure, you have to be very cool. You have to feel as a part of the family of the hospital, because all the staff is there to assist you, including the doctor. The doctor wants you to be pregnant. And after the procedure also, you have to be very cool. You have to feel that okay, small droplets of blood do come out after the procedure. This is normal. Don't panic for that. You have to just check whether you are passing urine on time or not, you are passing flatus on time or not, your bowel movements are normal or not. Immediately after the process, usually we permit liquid diet and soft diet, but that also you need to be like on soft diet. At least in the evening also you need to take soft diet. It's not essential because the procedure has happened. Basically it is essential because we give you IV sedation, there are drugs. So what happens, the bowel movements gets a bit restricted because you have not taken food for so long. So in that case, that is the reason we offer you soft diet. We tell you to take soft diet, don't eat anything from outside. It's not that you can't eat it, but what happens after you eat it, maybe you get some infection. So basically you have to avoid infections, you have to follow the doctor's prescription verbatim. So these are some of the tips. If you follow all these, definitely your IVF process, the egg retrieval process is going to be hassle free for you as well as the IVF doctor and the staff, believe me. And this is going to be a very good experience for you, because after you become pregnant, you are going to only remember all these taxing times. We care about you.